We wanted to provide an informal comparison between the pre and post-op imaging to help shed some more light on Brad's complications with extreme tightness and distortion of his abdominal wall. These comparisons reveal how much tighter he was made than his normal prior anatomy and adult history, as well as reference examples that are unbelievably comparable to the size of a 12-year-old boy. I am so worried about him. He is not sleeping with so much constriction on his chest and breathing mechanics. He's down to 1, 2, at most 3 hours of sleep each night. But this is unsustainable, having gone on far too long and without any release or path for correction that we desperately need.
So we wanted to provide a quick comparison and informal review of the pre and post-op radiology for my abdominal wall reconstruction. If you haven't done so, please also reference the current status video that details how these changes left significant complications of extreme tightness and asymmetry for me. On the right, we have the axial from the study conducted less than a week before the repair. And on the left, we have the axial from the study conducted a little more than a week after the repair. So you will see pretty quickly that even though the upper area only had a small rent in an otherwise normal and very fit upper abdomen, the operative team unexpectedly placed numerous staple firings in a loop that went through all layers that now cross-connect into the middle portion of the upper right muscle belly at the top of the repair. And even though there was no defect at this level, the muscles were pulled 2.5 centimeters tighter as measured from the lateral sides, from over 16 centimeters down to the incredibly narrow size of 13.5. And the transversus abdominis and right posterior appear to pull further inward along with the staples, which had been fired unexpectedly directly into the muscle itself, in addition to both posterior and the anterior layers. Next, there was a small 9mm rent, which you can see on the pre-op side. But again, the muscles ended up being pulled together nearly 2.5 times that amount at this site. And then once again, there is no defect at all. But post-operatively, there are staples that continue in both layers and the muscle moving further downward. And if we stop here for a moment, you can see there was an otherwise healthy and fit upper abdomen with no defect in this area that was still pulled together more than 2.5 centimeters tighter here, making me incredibly constricted as well as being limiting and causing restriction. With constant sleep deprivation of only 2 to 4 hours a night and frequent awakenings from the chest and abdominal constriction occurring along with bloodshot eyes. And notably, with indication that transversus abdominis muscles were pulled more medially here too, making things even more tight. Dense scarring starts to appear in the anterior layers once the staples end, and this continues to become more asymmetric and follows the deeper layers as you move through the lower abdomen. When we get to the area just above the umbilicus, you can see that I was pulled together more than 4.5 centimeters when there was only pre-op separation of 2 3/4 and no rents yet. And I haven't been anywhere near that narrow in my entire adult life. Again, far tighter than my normal anatomy should be at 15, tighter than I was in my 40s at 13.6, tighter than I was in my 30s at essentially the same size as my 40s, tighter than the size of a fit 18-year-old teen, and even tighter and comparative to the size of a 12-year-old boy. Moving downward, you can see the pre-op size of the umbilicus was 2.2 centimeters, and the thickest point of soft tissue was just over 1.5 centimeters. And once again, I was pulled more than 4 centimeters tighter here when it was just 2 3/4 preoperatively, with no accommodation for any normal linea alba width in between. Furthermore, I was told afterwards that my surgeon did not plicate, but rather cut out all the fascia in between, muscle edge to edge. You can see that the post-op combined width is super tight, and tighter than the size of the independent muscles themselves. And separately, the umbilicus is minuscule now, at 4 millimeters and floating above, which is 6 times smaller than before the procedure. And the soft tissue has now been bunched to the center and is tending upward twice as much as before, pushing out now 3 centimeters. Once again, you can see that I was pulled 4.5 centimeters tighter here, even though the pre-op separation was closer to 2.5 here. Importantly, this infraumbilical region is the area where the initial closure had noted integrity issues from compromised, scarred-in tissue and other tiny rents. This was repeatedly cited to be just over 3 centimeters for this principal stretch, but again, I was pulled together tighter than the actual size of the separation throughout. In addition, you can see that the muscles were pulled further rightward off the midline as the repair swings along its lower course, and the dense scarring on top follows this path as well. I was told that the dense scarring throughout the repair was attenuated tissue the operative team accidentally left behind. And I was also informed the end of the repair stopped short at this particular point above. And in addition, bilateral fat-containing inguinal hernias were left untouched, but had been there for many years and in numerous studies prior. Please reference the full-length post-abdominal wall reconstruction video for the full comprehensive overview.